Namaste. Myself, Jaypi Saxena, Faculty of Physiotherapy and Diagnostics. Discipline is Medical Laboratory Technology. My topic is influenza virus. Influenza, a seasonal disease. Influenza or flu is a common viral disease of the upper respiratory tract. There are three types of influenza virus A, B, and C. Major outbreak of influenza as associated with influenza virus type A or B. Infection with type B influenza is usually with B influenza is usually milder than with type A influenza. Influenza C is common but rarely causes disease. Influenza A is the most virulent type and is commonly associated with human disease. The structure of influenza virus present first layer of neuraminidase and hemagglutinin, nucleoprotein, RNA, and lipid envelope and capsid. What causes flu? The influenza virus particle virion is typically spherical in shape and carries its genetic material on 8 pieces of single stranded RNA referred to as segments. Each segment carries genes that encode for proteins that the virus needs so as to duplicate inside the infected host cell. The genome is protected by a membrane envelope protruding from the virus envelope are many copies of two different sorts of viral glycoprotein spikes. Approximately 80% of the spikes are hemagglutinin and therefore the remaining 20% are neuraminidase. The HA and Na surface protein are involved in viral attachment and entry to host cells. They are also the most a part of the virus recognized by our system as foreign, and most of the antibodies we make after infection are against these antigens. And transmission. The flu virus is extremely contagious and is transmitted from person to person by droplets expelled when sneezing and coughing. It also can be transmitted by direct contact, for instance, by touching virus contaminated surface like door handles, then touching the eye, nose. Good hygiene practice like correct hand washing and are vital by preventing infections. Infection and replication. Influenza virus infect epithelial cell within the upper tract, nose and thorax. If the infection is severe, the virus can eventually reach the lungs and cause pneumonia. The respiratory tract first line of defense may be a protective layer of mucus. The virus and a protein can transverse this, enabling the virus particle to in the somatic cell surface. The virus then uses its HA protein to contact to a receptor of the on the host cell wall and is taken into the host cell by endocytosis. The ribonucleic protein code that contain the viral RNA and therefore the viral polymerase used for replication. The released into the cytoplasm and moves into the nucleus. Viral RNA is replicated the host cell on ribosome are hedged to form protein from the viral messenger RNAs. New copies of the RNA genome are seeded out of the nucleus and up the cell wall where they combine with the newly made viral proteins and burst out of the cell wall, acquiring their envelope within the process. Finally, using the RNA protein to top them then sleep fairway from the infected cells, the new virons move away to infect other cells. The host cells are damaged once they become infected by the virus. The patient's system responds by releasing chemical called cytokinase which stimulate leukocytes to visit the location of infection and fight the virus. Most of the symptoms are actually caused by the body's immune reaction when the NA protein or influenza breaks down the mucus lining the epithelial cells. This also leaves the cells more sore-throated, non-productive, cough, muscular aches, and pains, headaches, and chills, severe fatigue, high fever, and these include vulnerable to infection by other pathogens like bacteria like Streptococcus aureus and Haemophilus influenza. Life cycle. The replication cycle of influenza virus from the time of entry to the assembly of latest virus is extremely quick with the shedding of the primary influenza virus from infected cells occurring after only 6 hours. Laboratory diagnosis. For the laboratory diagnosis of influenza viral infection, species should be taken as early as possible during the course of disease, preferably within the primary 72 hours after the onset of symptoms. Routine specimen for influenza virus diagnosis include nasal washing, nasopharyngeal aspirate, and nasopharyngeal swab, nasal and thorax swab. For successful isolation, specimens should be placed on a transport medium to stabilize the virus. And cell culture. Mesenchymal kidney cell line (MDCK) supplemented with trypsin supports growth and multiple cycle of influenza A, B, and C standard virus. Isolation is completed in cell culture tubes sheeted with MDCK cell. The culture are incubated at 34 degrees Celsius either during the stationary rack or during a roller machine. Some influenza virus cause a definitive cytopathic effect is MDCK cells. Several days after inoculation, negative culture should be checked by a hemoadoption or heme agglutination test at 2 to 3 days interval. Second, detection of infected cells to clinical specimen by immunofluorescence. A demonstration of infected epithelial cells is nasopharyngeal aspirate or nasopharyngeal swab may be a sensitive method. 50 to 90% sensitive than virus isolation. For the diagnosis of influenza, the result is often within a couple of hours after collection of the specimen. Cells in NPA and NPS are prepared, applied to microscopic slide and glued. Polyclonal sera and monoclonal antibodies are used as a reagent for staining process. And detection of influenza virus antigen by immunoassays. A variety of tests like radio immunoassay, EIA and fluoroimmunoassay are developed for the detection of influenza virus antigen directly in clinical specimen or after amplification in cell culture. Commonly, antigen in clinical specimen or in cell culture material are captured by specific antibodies that have previously adsorbed to the solid phase. After incubation, unbounded material is washed and therefore the bound antigen is reacted with a secondary antibody, then incubated further with a labeled antigen species antibody. And reverse transcriptase PCR. So, the polymerase PCR has been applied to detect influenza virus in clinical specimen and in cell culture or egg grow material. The viral RNA is first transcribed into DNA, which is then amplified during a second step that use suitable primers and DNA polymerase. Amplified DNA is electrophoresed in as agarose gel, and DNA is detected by staining with ethidium bromide. Relative molecule mass marker are included to spot and amplified DNA of the acceptable size. DNA also can be detected by molecular hybridization with specific label. Probes either in southern blots or by spot hybridization. Appropriate selection of primers permits type specific identification of influenza virus A, B, and C, or subtype specific identification of influenza virus. And serologically, although serologic methods seldom yield a result early enough or influenza, the patient's Treatment: they often established the diagnosis of influenza viral infection when the virus is not detected by other method. When the sensitivities of newly developed diagnostic tests are being evaluated, serology should be considered rather than or together with virus isolation because the gold standard. Hemagglutination inhibition test HAI, the neutralization test NT, and therefore the immune response test CFT, a traditional method in serology, serodiagnosis, and studies of influenza, but during recent year, EIA has found wide application. CF measure antibodies against the NP and thus allow the type specific detection of antibodies to influenza A and B virus. HAI and NT are for more sensitive and measure antibodies against subtype and strain specific antigen. Immunoagglutination inhibition test HIA and neutralization test NT are there for the immune response test CFT are traditional method the sero diagnosis and sero study of influenza, but during recent ELISA CF measure antibodies against the NP and thus allow the type specific detection of antibodies to influenza A or B virus. HAI and NT are more sensitive and measure antibodies against serotype and strain specific antigens. Treatment: most people get over flu within 1 to 2 weeks, but more serious illness and even death may result for secondary infections, example bacterial pneumonia. This is often more likely in infants, the elderly people that are immunocompromised, and people with chronic lung disease like emphysema. There are two ways of tracking the disease: treating and syndrome and attacking the virus. The symptoms are often alleviated with drugs to scale back fever and pain like paracetamol. Antiviral drugs are often effective against influenza but must be administered within the primary 2 days or symptoms appearing. Drug like Tamiflu attack the virus by inhibiting an enzyme neuraminidase and thus prevent the virus from infecting cells. Antibiotics are not want to treat influenza because they work by inhibiting bacterial cell membrane production and protein synthesis and block cell metabolism and have not any effect on virus. They will be want to treat secondary bacterial infection. And vaccine, antibodies that recognize the HA and NA surface proteins of the influenza virus can protect us from infection by spotting the virus reaching the host cell surface. This suggests that fog won't be infected by an equivalent strain of influenza after they got over flu. Giving a little dose of a triple strain of influenza virus or an injection of purified HA protein as a vaccine can stimulate the system to form antibodies to HA to guard us from flu. Thank you.